This is Still Unanswered. I'm Mara Klein. Today, the vanishing of Lars Mittank, 28 years old, 2 phone calls to his mother, a torn eardrum, a prescribed antibiotic, and the last clear images of him running out of Varna Airport, Bulgaria, in broad daylight. Then nothing. Over a decade later, we still have no confirmed trace. We also have a mother, Sandra, left with a single question: is my son alive? I'm joined by Dr. Elias Verhoeven, psychiatrist and researcher who studies first-episode psychosis and medication-induced neuropsychiatric events. Elias, thanks for being here.
Thanks for having me, Mara. This case, it's heartbreaking, and also one that raises a lot of medical and ethical questions. I'm glad we can talk it through carefully.
Right. Careful is the right word. We're not here for lurid speculation. We're going to lay out the facts we can verify, follow the likely paths, and use medical context to help listeners understand what might have been happening inside Lars' head without pretending to know what happened outside it. So let's start at the beginning. Elias, who was Lars, from what we know?
Lars Joachim Mittank, born in Berlin in 1986, raised in northern Germany by his mother Sandra. He worked at a local power plant, had a girlfriend, and was described by friends and family as sociable, stable, a typical 28-year-old. He went on a week-long holiday with 5 friends to the Golden Sands resort near Varna, Bulgaria, in late June 2014. By most accounts, the trip began normal: beach, clubs, a bit of football banter. Nothing in his history, publicly at least, suggested a vulnerability to sudden, violent paranoia.
So far, ordinary. Then we get to July 6th, an argument at a bar over football, which escalated into, according to Lars, a later attack. He disappears from the group that night and shows up the next morning with a jaw injury and a ruptured eardrum. He's told not to fly. He gets prescribed, this part is murky, but the consensus is a cephalosporin antibiotic, either cefprozil or cephalexin. He chooses to stay behind while his friends fly home. Elias, from the clinical side, how significant is that chain fight, injury, antibiotics?
Each element matters. A physical assault can be both a direct trauma and an acute stressor. Pain, bleeding, the sense of vulnerability, those are psychologically destabilizing. Then add being alone in a foreign country, limited language, and the social isolation of friends leaving. Medically, the prescription of a cephalosporin is routine for ear or wound infections. But we also know, rarely, cephalosporins have been associated with neuropsychiatric side effects: confusion, hallucinations, paranoia. In a susceptible person, or under certain conditions, dehydration, high dosage, or renal impairment, antibiotic-induced neurotoxicity is a real phenomenon. It's rare in young, healthy adults, but it's part of the differential we have to consider.
So we can't rule it out. But the timeline tightens. Once Lars' friends fly home on July 7th, he checks into Hotel Color Varna. CCTV captures him pacing hallways, peering out windows, hiding in elevators. He calls his mother at night whispering, says people are trying to kill him, and urges her to cancel his credit cards. The next morning, he takes a taxi to the airport. He sees the airport doctor, and at some point, when a construction worker enters the room, apparently the trigger, he panics, shouts that he doesn't want to die there, and bolts. The CCTV of him sprinting out of the terminal and over the fence is publicly available. Those are the last confirmed images. Elias, what does that behavior look like to you clinically?
It looks like acute distress with persecutory ideation. The pacing, hypervigilance, whispering calls to his mother, the insistence that people are out to kill him, those are classic persecutory delusions, or at least intense fear. The sudden explosive panic when the construction worker appears, there are two broad interpretations. One, he misrecognized the worker as a threat, an identifiable person he believed was part of a conspiracy. Two, he had a psychotic break in which a neutral stimulus became catastrophically meaningful, what we call a psychotic interpretation of reality. The abrupt flight behavior, leaving behind passport, wallet, phone, luggage, suggests an unplanned, urgent escape, not a deliberate plan to vanish.
Not planned. Important detail. Listeners, we'll walk through theories in depth. Sudden psychosis, antibiotic reaction, foul play, voluntary disappearance, and accidental death in the fields. But first, Elias, help us understand first episode psychosis. How often does it strike seemingly healthy people this late in their 20s? What are typical prodromes? And could Lars have had no warning signs?
Great question. The typical onset of primary psychotic disorders like schizophrenia often happens in late adolescence to the mid-20s for men, but it can present later, even into the late 20s and 30s. A first episode can be abrupt or develop over weeks to months. Prodromes, subtle changes in sleep, social withdrawal, odd beliefs, increased anxiety, can precede overt psychosis. But sometimes the onset feels shockingly sudden to family members, especially when the person experiences an acute stressor. Crucially, many first episodes occur without a documented psychiatric history. So it's plausible that a previously stable person could have a first psychotic break under a set of stressors: assault, injury, isolation, lack of sleep, and potential medication effects.
By the way, Elias, sleep deprivation. Could lack of sleep exacerbate or even trigger psychotic symptoms?
Absolutely. Sleep loss can increase anxiety, impair judgment, and in some cases precipitate hallucinations or transient psychotic states. When combined with pain and stress, it can be a potent factor. Imagine injured, anxious, alone, not sleeping well. Those are conditions that can lower a person's threshold for psychosis.
Okay, so one plausible cluster is assault, stress and pain, antibiotics and sleep loss, acute psychosis. Now to the antibiotic theory. You mentioned cephalosporin neurotoxicity is rare but documented. Can you give listeners an idea of mechanism, how an antibiotic could cause hallucinations or paranoia?
Briefly, certain antibiotics can cross the blood-brain barrier or affect neurotransmitter systems indirectly. Cephalosporins, especially in cases of high serum levels, renal impairment, or interactions with other drugs, have been associated with neuroexcitatory side effects, seizures in extreme cases, or less dramatically, confusion, agitation, hallucinations. The mechanism isn't fully understood, but GABAergic antagonism, reducing inhibitory neurotransmission, has been proposed. In other words, the brain's brake system is weakened, leading to overactivity, which can manifest as psychosis. Again, it's rare, especially in a young person, but the timing in Lars' case invites the question.
So we can't dismiss the antibiotic as a contributing factor, but we also can't pin the whole thing on it. Another angle worth exploring, the attack he reported, 4 men hired by Bayern Munich fans. Could that have been embellishment or fabrication? Or could there be actual organized intimidation behind it?
Clinically, Persecutory delusions often incorporate elements from a person's life. If Lars truly believed men were hired to hurt him, it could have been his interpretation of the attack, or it could have been true. From a psychiatric vantage, the narrative matters, because a delusion often contains an internal logic. The person is threatened for reasons that fit their world. From an investigative vantage, Golden Sands is a busy tourist area. Brawls happen. But organized hiring of attackers, that would be more unusual, and would likely leave some external traces, witnesses, comparable reports. Investigations to date have not produced hard evidence of an organized campaign against Lars.
So, the balance of evidence doesn't strongly support a criminal conspiracy, though it remains possible. Let's slow down and reconstruct the final morning, because that CCTV is the last verified record. He arrives by taxi, enters the airport, sees the doctor, and at the moment a construction worker enters, he bolts, leaving his suitcase, wallet, passport, phone, and medication behind. Then he sprints outside, climbs a fence, runs toward a field and a nearby forest. The footage is stark. Elias, how do we interpret that bolt? Was it more likely a hallucination, someone saying now, or a misinterpretation of the worker as a pursuer?
Both are possible. If he was in a persecutory state, a neutral figure could be instantly mapped onto the perceived threat, that's one of them, and trigger fight or flight. Alternatively, if he experienced multimodal hallucinations, voices and visual misperceptions, he might have been responding to sensory input others did not perceive. The fact he abandoned all his possessions strongly suggests the decision to flee was panic-driven and not rational. Clinically, it's not uncommon in acute psychosis for people to flee and take minimal belongings because the internal urgency overrides planning. Also, notice the consistency. He tells his mother people are trying to kill him. He behaves as if pursued, and he flees as a moment that seems trivial to us. That consistency supports the idea that, at least to him, the threat felt real.
Listeners, let's be careful here. Feeling real is not the same as being real. The human brain can make reality out of noise. But we must also acknowledge the family's experience. Sandra heard panic in his voice. She thought he was in immediate danger. Elias, what's the difference between a loved one's felt reality and a clinician's skepticism?
They're not opposites, they're complementary. A clinician asks what symptoms and triggers are present. A mother experiences the immediacy and emotional truth of the call. Both matter. For Sandra, her son sounded terrified, and he was. Clinically, that terror is an important symptom. It tells us he was in extreme distress. For an investigation, the question is whether that distress was caused by external actors or by an internal psychiatric process. We need to respect Sandra's fear while also examining objective evidence.
Right. Okay. Let's run through theories systematically. First, sudden mental illness, or first episode psychosis. We've laid much of the groundwork. Elias, what would make you favor this theory?
I'd favor it because of the abrupt behavioral change with paranoid delusions, the absence of credible evidence for sustained external pursuit, and the pattern of hypervigilance, whispered phone calls, and sudden flight. The age fits, stressors are present, and the leave everything behind sprint is very characteristic of a psychotic panic reaction. Also, the fact that he expressed that they were getting closer, this is a classic persecutory theme. Finally, the absence of any confirmed trace later could fit either death in the environment or survival under altered circumstances, both possible consequences of a psychotic break.
And what would weaken that theory?
The main weakness is we still can't find the body or evidence of wandering. Many people with first episode psychosis either present to local services or remain in their communities. It's unusual, though not impossible, for someone to vanish without trace after running into nearby fields. Another weakness is the lack of any prior psychiatric signs, though, as I said, that doesn't exclude a first episode. Finally, the antibiotic question complicates the narrative. If medication played a causal role, then the event was drug-induced psychosis rather than a primary psychotic disorder.
Okay, let's take the antibiotic theory on its own. If we imagine the cephalosporin caused a neuropsychiatric reaction, how likely is it that such a reaction would escalate from whispers to full-blown panic and running away?
It's plausible. Drug-induced psychosis can range from mild confusion to full persecutory delusions and significant agitation. Cases reported in the literature include severe agitation and psychosis requiring hospitalization after cephalosporin exposure. However, it's rare, especially in young patients with normal renal function. Another issue is dosage and compliance. Reports suggest some ambiguity about whether Lars had actually taken the medication regularly. If he took only a few doses, the likelihood that the antibiotic alone produced severe psychosis is lower. But a single dose in a vulnerable individual, combined with sleep deprivation and trauma, could still contribute. The key point: antibiotics could be a contributing or precipitating factor, but they are unlikely to be the sole explanation without additional vulnerabilities.
Listeners, you'll hear people online confidently asserting the antibiotic killed his mind. The literature supports rare, serious side effects, but not a simple causal arrow in this specific case. Now, Theory 3. Foul play. Could the men from the bar, or some criminal group, have tracked him to the airport? Could he have been abducted after the sprint?
From a behavioral standpoint, if he was actually being followed and sensed them, his flight makes perfect sense. He would run to escape. But for foul play to be the dominant theory, we'd expect corroborating evidence. Witnesses seeing men following him outside. Evidence that anyone used his ID or cards. Reports of suspicious vehicles, or later sightings of him in captivity or deceased. None of that has emerged in any verifiable way. Moreover, his possessions were left behind untouched, which is odd if robbers were the motive. Trafficking is raised by some online commentators, but again, the lack of evidence for post-disappearance exploitation weakens that line. Foul play is possible, but it's not supported by strong forensic traces in the public record.
So foul play can't be dismissed entirely, but it's a weaker hypothesis compared to acute psychiatric explanations, given the available evidence. Theory 4, voluntary disappearance. He staged it to start a new life. That sounds implausible to many. He left passport and wallet. Elias, do people really vanish in that way?
People do abandon their lives, yes. Some walk away intentionally, sometimes without money or ID, and manage to survive as transient persons or under new identities. But it requires planning or extreme risk tolerance. Here, the abandonment of passport and money suggests panic and lack of planning. Also, why call his mother and urge cancellation of cards if you plan to start anew? That action implies he believed he was genuinely threatened. So while voluntary disappearance is a possibility in general, in Lars' case, the evidence points more toward an involuntary crisis.
Finally, Theory 5. Accidental death in the forest. He runs into dense vegetation. Could he simply have succumbed to heat, injury, animal predation, or been missed in searches?
Yes, this is tragically plausible. Someone panicked, disoriented, possibly injured or dehydrated, runs into thick sunflower fields and scrub. If he fell into a ditch or collapsed and wasn't found, or if scavengers scattered remains, it could explain the absence of a body. The terrain around Varna can be dense and confusing. Multiple searches were conducted, but search operations are fallible. So accidental death is a plausible, albeit unsatisfying, explanation.
It's unsatisfying because it denies resolution. Elias, I want to ask a practical question. If this happened today, in the age of smartphones, GPS, better consular coordination, could the outcome have been different?
Potentially. Smartphones with GPS can reveal a person's last known coordinates. Immediate consular involvement can facilitate local police responses and searches. Importantly, a medical team trained to recognize acute psychosis might have restrained and treated him, or at least provided observation rather than medical clearance to fly. On the other hand, if someone flees into terrain, GPS helps only if the device remains on and with the person. In Lars's case, the phone was left behind, which eliminated that avenue. But overall, faster multi-agency coordination and modern communication might increase chances of survival or recovery.
Right. So, systems matter. Let's switch gears. The cultural afterlife of this footage. The Varna CCTV is everywhere online. People have watched, remixed, theorized. What are the ethical implications of turning a man's last known terrified moments into viral content? Elias?
This is a hard one. On the one hand, publicity kept the case alive and produced tips. On the other, commodifying someone's trauma can be re-traumatizing for family, and it risks encouraging speculation and misinformation. Viral looping of the footage can transform genuine grief into entertainment. Ethically, I think we owe the missing person and their family dignity, context, caution, and restraint. Keeping attention on verified leads and official requests is useful. Turning it into a spectacle is not.
Sandra has spoken publicly and said she appreciates attention that helps, but she also decries wild speculation. Listeners, that's important. If you want to help, share official missing person posters or contact local authorities with credible tips. Don't amplify unverified claims. Elias, I want to return to the clinical angle for a moment. Suppose a tourist in a foreign country experiences sudden paranoia or psychosis. What should friends or consular services do? What are practical, compassionate steps?
First, safety. If someone is acutely psychotic or suicidal, emergency services should be contacted. If there's a language barrier, consular offices can help translate and coordinate. Stay with the person if safe to do so. Don't leave them alone. Try to get them to a medical facility where staff can assess for organic causes: infection, intoxication, head injury, metabolic disturbance. Bring any medication bottles, not necessarily to attribute causality, but to inform care. Keep the family informed. If possible, avoid confrontation or arguing about the reality of their beliefs. Validate their distress and try to move toward medical evaluation. In short, treat it as a medical emergency.
That's practical advice. Let's take a minute to walk listeners through the most haunting piece of objective evidence, the CCTV. I want Elias to narrate, step by step, what we see and what each moment suggests medically. Elias?
On the footage, you see a young man, yellow t-shirt, dark shorts, walking briskly, carrying a large rolling suitcase. He looks tense, checking behind him. He enters the clinic area, then, almost suddenly, he bolts. He leaves the suitcase and smaller bag behind, items that would be essential for a planned departure. He sprints through the departure hall, out the main door, crosses the tarmac area towards a low fence, vaults or climbs it, then runs across a cultivated area, meadows and sunflower fields, and toward tree line where he disappears from view. Behaviorally, this is frantic escape. Medically, it's a fight-or-flight reaction at its peak, immediate, imperative, and without planning. He's not looking for an exit sign. He's trying to get away from something he perceives as an imminent threat. The fact the items were left behind is crucial evidence against a voluntary disappearance.
Listeners, I want you to hold that image. A man so terrified that he runs away from officialdom and safety, leaving behind everything. Elias, we mentioned earlier the construction worker's entry as the proximal trigger. Is it possible that something about the worker, his clothes, his gait, a tool, matched something from the earlier attack and caused flash recognition?
Yes. Persecutory delusions often latch onto specific cues. If the attackers had a distinctive look, a hard hat, certain boots, a gait, the sight of a similarly attired worker could trigger an associative memory or illusion of recognition. In psychosis, this process can be immediate and compelling. Alternatively, if there was no objective match, it could still be a psychotic attribution. The mind finds patterns where none exist. Either way, to Lars, it was decisive.
So even a small, ordinary stimulus can become overwhelming when the brain is primed that way. We promised to cover uncertainties. Let's list the questions that remain most painful for Sandra and for investigators. Where did Lars go after he left camera view? What happened during his missing hours after the bar fight? Why did he call his mother to cancel cards? Was that authentic or a symptom? Did he take the antibiotic? And was there any foul play? Elias, what answer would you personally place highest probability on, given the balance of evidence?
If I had to weigh probabilities, recognizing this is not a diagnosis but a reasoned estimate, I'd place highest probability on an acute psychiatric event precipitated by stressors and possibly medication effects, leading to flight and likely death or disappearance in the surrounding terrain. That doesn't rule out other scenarios, but it fits the behavioral evidence. Pacing, panic calls, irrational fears, the sudden bolt leaving belongings. It also explains the lack of subsequent verified traces, because someone disoriented alone can become lost in thick fields or woods.
That's sober, clinically grounded, but it's not certain. I want to pause here and acknowledge again Sandra. We'll include links in the episode notes to the official missing persons page and to ways listeners can responsibly share information. No sensationalist theories. Elias, we've been talking mostly in abstract. Do you mind, if it's appropriate, reflecting for a moment on the human side? What is the subjective experience of persecutory delusions or first episode psychosis? How might it have felt to Lars?
It can feel like absolute certainty that the world is against you. People describe an all-consuming fear, the sense that strangers are plotting, that ordinary places are dangerous. Sensory experiences, voices or visual misperceptions can command action. Time distorts. Seconds feel like hours. You can't convince someone out of a delusion by argument. From inside it, it's an existential threat. For Lars, we can infer terror from his voice and behavior. He was not calm. He was convinced of danger, and his actions flowed from that conviction. Imagine being in a small clinic, and an ordinary person walks in, but in your mind, that person is a sniper. The need to escape can overwhelm rational thought.
That description is chilling. It also gives us real insight into why a young man would run barefoot into a field with no plan. I want to give listeners a sense of the investigative response. The airport footage was released, searches were conducted of fields and woods, and private investigators and volunteers tried to follow leads. Over the years, there have been unconfirmed sightings, a possible hitchhiker in Germany, a mistaken identification in Brazil, and dozens of tips that went nowhere. Elias, how often do missing persons cases like this resolve after a decade?
Statistically, the longer a case remains unresolved, the less likely we are to find conclusive evidence. That's not absolute. Cold cases are sometimes solved years later. But in disappearances, where the person lacked planning or transport, and where no body is found in the immediate environs, the odds of finding closure diminish over time. However, modern DNA databases, improved interagency cooperation, and changes in migration patterns have solved older cases. So there's hope, but the practical probability of resolution decreases with time.
Listeners, that's a tough reality. I want to talk about the role of the internet now, how YouTube and true crime channels turned this into a global mystery. There are pros and cons. Attention can bring tips. It can also bring conspiracy and harassment. Elias, from your experience, how does public attention affect families and investigations?
Public attention can be a double-edged sword. It keeps cases in the public eye and can generate useful leads. But it also can amplify misinformation, people offering unverified sightings, speculative causes, or harmful narratives. Families often face re-traumatization from insensitive commentary, and policing resources can be diverted by noise. Ethically, media producers should prioritize verified facts, avoid sensationalized speculation, and respect the family's wishes. For investigators, managing public interest is part of the job, encouraging credible tips while trying to limit false leads.
Which is why, at Still Unanswered, we aim for careful, evidence-based examination with empathy. We're coming up on the end of this episode, but I want to leave listeners with concrete takeaways, both emotional and practical. Elias?
Emotionally, this case reminds us how fragile human mental health can be, especially under stress. A previously stable person can experience a catastrophic break. Practically, if you or someone with you is experiencing severe anxiety, paranoia, or confusion, especially while traveling, seek immediate medical help. Keep them from harm. Contact consular services if abroad, and get them to a medical facility for assessment. And for the public, share official information, not rumors.
And for investigators and advocates, keep searching in measured ways. New searches, reassessment of terrain with modern techniques like LiDAR or cadaver dogs trained for particular scents could still yield answers. For listeners who want to help responsibly, we'll put links in the show notes to the official missing poster and trusted reporting. Avoid social media sleuthing that harms the family. Elias, any final thought you'd like to leave about conditions that might prevent similar tragedies?
Better traveler education about medical risks, better systems for immediate psychiatric assessment in airports and tourist zones, and stronger consular outreach could help. Clinicians must also be aware of rare medication side effects and treat psychiatric symptoms with urgency, particularly in unfamiliar environments. And we all need to reduce stigma so people seek help early without shame.
Thank you, Elias. Listeners, the last confirmed image we have of Lars is a man running toward a forest, terrified, abandoning himself to the unknown. Over the years, that image has flickered across millions of screens. For Sandra, the mother, it isn't a viral clip. It's her son. That human pain is at the center of every phrase we've spoken today. If you have credible information about Lars Mittank, contact the German authorities or the Varna police. The links are in our notes. If you want to discuss theories, please do so responsibly and with respect for the family. Elias, before we go, one word. Hope?
Always. Hope, yes. For answers and for Sandra. Hope for improvements that might prevent someone else from vanishing like this.
Thank you. This has been Still Unanswered. I'm Mara Klein. Thank you to Dr. Elias Verhoeven for joining me. If you value careful, ethical coverage of cold cases, consider supporting our work. Links in the episode notes. And one last thing. If you're struggling with mental health or know someone who is, reach out. You're not alone. This episode was produced with research from public reporting and the family's own statements. We'll list our sources in the show notes. Good night.